Executive producer, Brian Hertzock. Presents Bobbie Clark. Education, current events, and topics that affect you.
Welcome to Let's Talk About It. We have great guests today, and we're going to be talking about a subject that I know is of interest to you. First, I'll introduce my guests. Attorney Otha Nelson. Good having you here today.
Pleasure to be here.
Thank you. And Caesar Wilson. And we're going to be talking about wills. We'll be talking about the living will and the living trust and all of those things that we need to prepare and have ready, and we sometimes don't. Statistics show that more than 60% of the people in the United States have no documents in writing. So, Attorney Nelson, thank you for being here today. And I want to ask you, what is a living will?
A living will is a document that an individual prepares for future purposes prior to their death, with instructions to the family and to the doctors as to how they want their affairs to be handled in the event that they should become terminally ill, whether or not they want to be put on life support. So it's an instrument that I feel that the individual, once he makes it, it helps the family make plans on how they should care for a loved one in the event they become ill.
Okay, so now tell me, what is the difference in a living will and a living trust?
A living will basically provides for instructions for medical care that an individual would receive, and a trust, a living trust, is an instrument that allows an individual to dispose or control their property in the manner that they would like to control. Particularly, it helps the owner of property determine how they want their property to be utilized after they're died or they're deceased. So the living trust gives the person an opportunity to make provisions that they might not would make in a last will and testament. So
the living trust and the last will and testament are different?
Yes.
In what way?
Most individuals and attorneys who promote living trusts, they say the advantage of having a living trust, it makes it so that you won't incur the expenses of attorney's fees, because if you have a last will and testament, a last will and testament will require that it be probated. And what lawyers and people in the legal profession refers to probate is presenting the will to a judge or to a court to verify that it is a valid will in accordance with Louisiana state law if the will is drawn up in the state of Louisiana.
Okay, now just for clarification for my viewing audience, a living will deals more with the medical part of a person's life, how they want to be. In a situation, my brother passed, and some of the siblings were, we want him on life support. And the way that, and I knew he didn't want that, but I didn't know if he had a living will. And my mother said, oh yeah, he did one the last time he was ill. So we were able to pull that get to the hospital and have that hospital to send that living will on to the other hospital so that we could adhere to his wishes. Now, that's basically what a living will would do.
Yes, and you bring out an interesting point, and it's the person mental capacity and why a person should not delay in preparing a living will, because we as human beings, we don't know when we will lose our ability to think for ourselves.
Yeah, it could be in a car accident. Anything can happen.
Yes,
Huh?
so it really would be wise for a person, even a young adult, the earlier they made a living will, the earlier their family members and loved ones would know what are their desires.
And it eases the family's, I should say, it eases what the family has to deal with if that's in place.
That's correct, because I recently experienced going to the hospital and doing a living will and to a nursing home, and the family members asked me if their loved one needed to make out a last will and testament. Well, as an attorney, I'm also a minister too. I ask God for wisdom when I start discussing last wills with somebody who might be on their dying bed, because I don't know what the psychological impact would be on that individual. So if that person could have come to me before they got into serious medical condition, I wouldn't be as apprehensive to try to discuss, you need to make out a will.
I see. You think that you can be at a point where psychologically that person may not be strong enough and it is not the time to ask. Maybe even health-wise they may not be strong enough.
That's correct, because what the family in most instances would be trying to do, if they're not selfish and egotistical, want that loved one to recover. And anything that possibly could cause that loved one to have a setback, and I'm not a doctor, but I've been around, and I'm a human being, and I normally like to do unto others I'd have them do unto me. So it's a delicate situation.
Okay, we're going to take a break here, and we will be back in just a few moments. And you stay tuned.
Sponsored by. Do you want to boost your student scores on the ACT? We can help.
And welcome back to Let's Talk About It. I'm Bobbie Clark, your host, and our guest today, Attorney Otha Nelson, and also Caesar Wilson. And Attorney Nelson, we were talking about the living will and the living trust. What is the difference in the living trust and inter vivos trust?
When you're saying living trust, it's something that we're talking about that's occurring at the time the person is alive. And inter vivos, normally when you say inter vivos, that's referring to something where you're still alive and it takes effect after the person is deceased. So basically, it's where the individual who's making the trust still wants to maintain control over the property or decisions that are made in the trust. He's able to do that while he's still alive. I'm saying he or she.
Sure.
Yes.
Okay. Why should a person have a will? Is it really necessary?
Under Louisiana law, from an economical standpoint, if a parent has 4 children and that parent desires for all of the children to share in the estate equally, and the brothers and sisters get along real well, I will sometimes tell a person, you might not need a last will and testament if that's the way you want your estate to be distributed.
No matter how much property there is, there would not be a need if it's going to be divided equally.
And again, it comes back to where the siblings, if the siblings have a good relationship, and unfortunately, the last 20 years that I've been practicing law, and I've been a lawyer for 41 years, I've found that brothers and sisters don't get along the way they used to 41 years ago when I started practicing law. And it might be because of the financial status that we have been able to achieve and accomplish, because when I first started practicing law, most families had to sell dinners to be able to pay for a funeral. Well, now we're blessed where I've recently found out I'm involved in a state where a gentleman never been married has an $8 million estate in New Orleans. And it's unfortunate that he did not make a will because the family members are fighting over who's going to get what.
$8 million without a will.
Without a will.
That's serious.
It is serious. And what makes it a problem is that one of the heirs was under the impression that he was going to leave everything to her. And not being able to locate the will, the burden of proof is on her. So it makes things simpler for your people that you're trying to leave your property to if you leave a last will and testament.
Well, yeah, and we're going to get to that because that letter of instruction, as I appreciate, would help with that because it'll tell everyone where everything is, because it's one thing to have the will, but it's, as you're saying, it's another to know where that will is.
Right.
Well, we're going to talk with Caesar first, and then we'll come back and talk about that letter of instruction and other things that we should know as far as making sure that our heirs are knowing, are knowledgeable of where everything is. But Caesar, I wanted to take a moment to talk with you because you had mentioned to me earlier that your parents left a will. Am I correct?
No, they didn't leave
Oh,
a
they
will.
did not leave a will.
No.
Okay, so when they passed away, the siblings were left with quite a bit of property.
Right.
Want to tell me about that?
Okay, we had 60-some acres of land in Madison Parish and Tallulah. There was 9 siblings that figured into the property. So in 1980, I decided that I would open up a succession on the property.
And when did your parents pass?
My dad passed in 55, and my mother passed in 73. The succession hadn't been opened up until then.
Now, do you still have the property?
Probably
You-
still
and
up
still
there.
renting
Right,
it.
Still renting it.
Okay. Now, what would it have been like had you not done the succession and had you not had all agreeable siblings?
Okay.
Could this have been quite different?
Quite different. Quite different. I had a good experience with a cousin of mine who had a property across the bayou from my property. I tried to get her at the time to let me help her to get succession on her property. And I said, I also will have Ken to come down and do your survey work. She said, oh, no, so I ain't going to bother with her. Say, just let the rest of them handle it, when they be in charge of it.
So basically, she may not have had the money, you think, to...
I told her, I said, now you're renting the land, you're getting the rent off the land each year from this guy who's renting the land. And I told her just how I did mine. I said, you don't have to put up no money up front for your succession or your survey work. You can take this money off the top of your rent and give the rest of it to the heirs. I said, it's very simple. She said, no. I said, I don't want to do that. Okay, so finally, about 4 or 5 years later, she died. She had 5 sons, and one of the sons was living with her when she died, and he was going to be over the property, over the rent collecting and distribution and so forth.
For her siblings, and then also
the rest of it.
Yes.
Now there was four original siblings, and they had children. Okay. Now one thing very interesting about this, the original owner of the property, my uncle and auntie, had very good vision back at that time. You know, they had
Okay, hold that thought. We're going to take a break here,
Okay.
and we will be back in just a moment.
Sponsored by. Do you want to boost your student scores on the ACT? We can help.
And welcome back to Let's Talk About It. Our guests, Attorney Otha Nelson and also Cecil Wilson. And when we left, Cecil was telling us about his cousins who had now, the relatives had passed away and what transpired. You want to tell us about that? Continue with that subject.
Okay. After the last relative passed, I had a chance to look at the will that her dad left several times. It was a written will, but it was an authentic will, and it was authorized and documented, well documented. But one of the heirs said that his grandfather said that if any one of the group decided to sell their land, they would sell their land back to a member of the family. This was not on the will, okay?
Okay.
So after the heir died, this cousin of mine died, I told my cousin, her son, who was going to be the administrator of the property, I told him, I said, now, you need to do something real quick now, because you're going to have trouble with the rest of these heirs out here, because they sort of respected your mama, and they're not going to respect you like they respected your mama. You got to do something about this land now. So they didn't listen to me at all, okay? One of the girls in Houston decided that she wanted to sell her 5 acres of land.
Okay.
All right? A guy was waiting to give her $12,000 for her land. She got her $12,000 for her land. And then there was a brother, one of her brothers, who had 10 acres of land in that parcel.
Well, was that a good going price to $12,000?
Not really. It was pretty good, but not really.
Okay.
She could have got more than excellent farmland. Excellent farmland. So he decided that he wanted to do the same thing. So he sold 5 of his acres to the same guy. Okay? And now...
So everything is relative to where those acres are, right?
Yes. But
Because as I appreciate, you can have acres and they could be on the outside or they could be in the middle somewhere, and it could make it very difficult for those who are in a wrong position with the amount of land that they have.
Exactly. So
Is that what happened here?
So what's going to happen is that this guy going to eventually come on in, and he's going to get the whole thing.
Because of the land that he's already purchased, how it's situated.
How it's situated, right?
Oh,
Exactly.
okay.
Exactly.
All right. Well, those are the kinds of things that happen, but this sounds, Attorney Nelson, like there was a will that wasn't respected here.
Well, it was a will, but it wasn't. It was the will saying how much. Now
it was saying how much land they would get, but it didn't stipulate how the sale, how everything should be manipulated after that point.
Well, they didn't divide it and give everybody a deed.
Gotcha.
Okay.
So then, in essence, if the person knew where their 5 acres were.
No, they couldn't.
Oh, so how would they sell it? How could you sell something if you didn't?
Well, there's a law that you can sell, and the attorney Nelson can tell me the right term for this.
Mm-hmm.
But if someone has some property within a group,
yes,
they can sell that part out.
Even if they don't know where that part physically is.
People don't know where.
Interesting.
Yes.
Interesting. Well, Attorney Nelson, I had another question about the letter of, first, the nursing home. If a person is about to go into a nursing home, does the nursing home get all of their property, all of their assets, or can the person prior to going into the nursing home write a will or have a will done to avoid this?
Well, my experience has been the person don't write a will, but they donate the property to an individual. And normally when you donate property to an individual, you're giving up your right of ownership, because some of the nursing homes, they determine the amount that a patient or consumer or client is required to pay for their keep and stay in the nursing home based upon the amount of property that they own or the value of their estate.
So then, is it a good idea to have a will done prior to, or donate your property prior to going into the nursing home, or does it matter?
It matters, and in my opinion, the state of mind the individual have. I use Mr. Wilson as an example. He didn't tell his age, but he's 84. So he's still mentally alert and able to handle his affairs.
But it isn't because of his age, though, because you could find someone who's 70 or 65 who may not have the same mental acumen that Mr. Caesar has here. So basically, can you just look at that, or do you literally have to have a medical examination? Because I've seen some folks who were 70 or younger who I would say that their mental capacity would deem them unfit to be able to make these decisions.
And I guess the thing that sort of puts me in a quagmire, or state where I have to think, some people don't want to be placed in a nursing home. So, and again, it depends on the family makeup. I've known individuals who have made their mind up, they will quit their job in order to take care of their mother, to keep the mother from going to a nursing home. So
yes.
Again, when you talk about a letter of instructions, I've never seen this in a letter of instruction, but I think if some children will respect their, I'm going to use mother, their parent, I don't want to be put in a nursing home. Well, if you're going to respect your parents' wishes, then that question wouldn't be brought up. But then if the mother get in a situation where the family can't care for them, then that's whenever the consideration of donating the property. And to my surprise, I'm from North Louisiana, and I was thinking, my 7th grade school teacher, I was surprised that her estate was worth as much as it was worth. And she died and left a nursing home bill of $96,000. Now, she had a last will and testament, and she named an executor. And so what wound up happening, her estate was sued because the executor didn't timely pay her bill that she owed to the nursing home.
Okay, but it still could be paid. He hadn't spent the money, right?
No, he hadn't spent the money.
Okay,
Yes,
all right.
Yes.
Okay, all right. So, What legal documents do senior citizens need? What would you say are you would recommend so that at their demise that everything is in order?
I like a phrase that you've used, and even though I've been a lawyer for 41 years, I had never heard of the concept of letter of instruction. And the way I would interpret a letter of instructions is written plans or information as to what you want to happen. And I can say that I have been involved in a state where the lady in her last will and testament, she gave instruction as to where she wanted her funeral to be, what dress she wanted to have worn. That was included in her last will and testament. It was what we call under Louisiana law an autographic will. That's a will that's written by the individual.
Okay. Well, we're about to wrap up here, and this has been a very interesting conversation. And to my viewing audience, I hope that you were able to get some value out of this, because so often we are not taking a will of any sort, living will or a will that we will have at our ending. And so basically what we would call, when I was growing with, is it's like getting your business in order. And so that's what we're looking at here when we share this information with you. And I want to thank you, Attorney Nelson, for sharing your information. And Mr. Wilson, I thank you for sharing some real life things that have happened, and audience, so you can see the importance of having the will. And thank you so much, and stay tuned because we'll be right back.
Sponsored by, do you want to boost your student scores on the ACT? We can help.
Welcome back to Let's Talk About It. I'm Bobbie Clark, your host, and my guest is Lynn Medley Long, and she is the CEO of Baton Rouge Primary Care Collaborative. Welcome.
Thank you.
It is so good to have you here and to talk about BRPCC, the Baton Rouge Primary Care Collaborative. That's a mouthful.
Yes, it is.
And Lynn, I understand that you have 2 locations, and I want you to tell me where the locations are and what services they provide.
Sure. Thank you for having me, Bobbie.
Oh, for sure.
Baton Rouge Primary Care Collaborative is a multi-site, federally qualified health center that operates in East Baton Rouge Parish. We operate 2 community health centers. One is located in the Joel Newman Community Center in the Scotlandville community. The other is located in the Capital Area Alliance for the Homeless Center in downtown Baton Rouge.
Where
and
downtown?
That is on 17th Street and North Street.
Okay,
North
at 17.
At 17.
Okay.
And that facility is primarily focused on care, providing primary, preventative, basic health care to the homeless. We are one of the only providers in East Baton Rouge that has a separate, distinct program, healthcare program for the homeless.
It is so good to know that you are there for the homeless, because that population of homeless seems to be getting larger instead of smaller.
Yes, but not only the homeless. We, as a federally qualified health center, provide primary or preventative health care services, and we are accessible historically by mission to those who typically have been outside of the mainstream of healthcare, who don't identify with the mainstream of healthcare, those who lack access, and those who are typically we define as medically underserved. That would include the homeless, but also include the immigrant population. It would also include the uninsured population, and it would also include the Medicaid population, who often have difficult time accessing the mainstream of our healthcare system.
Well, why would they have a difficult time if they're on Medicare, what would make it difficult for them to access treatment?
Let me be very clear. The population that typically has, that we serve, that we consider medically underserved, is not the Medicare population, but the Medicaid. These are medically and income needy populations that typically, like the homeless, immigrant, and Medicaid population, that are typically economically disadvantaged.
Okay.
And because of that, they're in our American healthcare system. From time to time, you would have a problem accessing healthcare because of your inability to pay for healthcare. And that's the population that we as a federally qualified health center by mission target to make sure we provide services to, and we consider ourselves the safety net healthcare providers for all of those people who are falling through the cracks in our healthcare system because of low socioeconomic status, homeless status, immigrant status, those people, again, who typically don't identify with our mainstream healthcare system, who typically fall through the cracks.
And how many persons are we talking about? Would you say an estimate of the number of people that your agency serves?
We at Baton Rouge Primary Care Collaborative generate about 6,000 encounters or patient visits a year, and our practice serves, we have about a 15,000 patient base in our practice. So we serve and provide care to over 15,000 people, and about 6,000 of those seek services from us each year.
Okay. All right. So I was going to ask you how many persons are served. Would you explain the whole person healthcare model?
Sure.
I've not heard of that before.
As a federally qualified health center, let me make it clear, Baton Rouge Primary Care Collaborative is one of over 1,200 community health centers in the country and 28 in the state of Louisiana that operate under the banner we define as community health care centers.
And they're federally funded?
Yes, they are.
Okay.
In addition to federal funding, most community health centers throughout the country and in the state of Louisiana have a broad base of funding sources, not just direct federal funding, although direct federal funding is an important part of our funding source. It is not the exclusive funding source. We are also funded by state, local, charitable organizations. We are also funded by Medicaid and Medicare. We're also funded by commercial insurance. We also have patients who pay privately. We do provide, as a federally qualified health center, for anyone under 200% of the poverty level, we provide what's called a sliding fee discount. So anyone who seeks services in a community health center under 200% of poverty would be automatically eligible for a sliding fee, which means we discount our fees to make it affordable to them. Again, the purpose of our health centers, community health centers, is to make sure that we are there creating a safety net for access to primary preventative health care services for people who typically fall through the cracks and have a difficult time accessing medical services.
Now, are you able to connect with hospitals? So if this person who comes to you is in need of care in a hospital, can they be referred from you?
Yes, they can. Let me answer your question on the whole person healthcare model and tie that in with how we align ourselves with extended services, ancillary services, and hospital services, and how we fit in the whole healthcare spectrum. As a community healthcare center, we are, by mission and mandate, required to provide what we consider comprehensive healthcare services, not just medical services. So comprehensive healthcare services for us basically means we treat the whole person. We provide medical services and a whole host of behavioral health care services, mental health care services, social services, and a whole array of services that basically define us as a facility, community health care centers that basically treat the whole person, unlike other aspects of our healthcare system where they only treat the eye, the ear, the neck, or the leg. Mm-hmm. When you're in a community healthcare center, we're focused on disease prevention, chronic care management, and treating the whole person. And the whole person healthcare model is based on long-term relationships with patients and their families to manage chronic care, prevent illness, and treat the whole person. As we relate to other aspects of the healthcare system, we are not an emergency room, we are not a hospital, we are not an urgent care center. But we do have relationships with hospitals when patients enter our facilities and they need ancillary services like MRIs, radiology, or hospital inpatient stays because of acute conditions. We do have what are called continuity of care arrangements with hospital specialists, labs, ancillary facilities that we coordinate care with and manage care through.
So, do you have doctors? Do you have doctors, but how many doctors do you have within your facility?
Baton Rouge Primary Care Collaborative employs 14 full-time equivalent employees, including doctors and mid-level practitioners.
Okay, very good. So you have the staff to act so that these patients who you receive, they are able to get good service.
Yes, ma'am, and we have plans to expand our comprehensive scope of service to include not just the medical, behavioral, mental health, and social work services, but we also have plans to include dental care services. We plan in the next year to expand our services to include some school-based programs and services for our school-based population, and we may also be reaching out to the jail and prison populations.
So that means that they would be coming to you also.
One of two.
Okay, I want you to hold that thought. We're going to take a break here, and we'll be back in just a moment with Let's Talk About It.
Sponsored by, do you want to boost your student scores on the ACT? We can help.
And welcome back to Let's Talk About It. Our guest is Lynn Medley Long, and she is the CEO of Baton Rouge Primary Care Collaborative. And when we left, Lynn, we were talking about your growth. Matter of fact, that the things that you're looking to do within the next few years.
Yes, and we are very excited about the possibility of expanding our services to include school-based services, dental health services, pharmacy services, as well as extension of services to the jail and prison populations. And we can do this one or two ways. We're still in the planning phase and dreaming phase of this, but our intent really is strategically to position ourselves to be as great of a resource to meet the needs that exist in our community. So as we survey the community and see these needs, we just feel it's the appropriate response to respond to those needs, and if that means expanding services to different populations, we do it. It's not just Baton Rouge Primary Care Collaborative. This would be typical of the over 1,000 community health care centers that operate throughout this country and the 28 that operate in the state of Louisiana. This is typical whole person health care, responsive community health care, right in the community, accessible to the community, that community health care centers, which serve as a safety net in this country, provide across the country and not just in East Baton Rouge.
Well, let's talk about the Louisiana's national rankings in leading causes of death. Would you share information on that? I knew the situation was bad, but when I went through some of your stats, it's looking even more, frustrating.
Unfortunately, Louisiana has a dismal rating.
Yes, it does.
Compared to other states across the country. Surprisingly enough to me, I just found out that Louisiana is the second largest gas and oil producing and revenue generating state, the second in the country for gas and oil. So they're making tons of dollars. However, it is ranked second in the list of worst. It's ranked second to the worst in the nation on healthcare indices. Louisiana has the poorest ranking for HIV, new cases of HIV, sexually transmitted diseases, obesity, cardiovascular disease. So while we are generating great economic wealth in this state, the health condition of our residents is getting worse, and that's amazing.
What do you think is the reason for that?
I think there's a disconnect somewhere, Bobbie, and we as community members, we as healthcare providers got to find a disconnect.
Yes.
We got to do, where are the points that we connect? We got to do better at educating patients. We got to do a better job at preventing disease and illness and not waiting for chronic conditions, which are very costly to treat in the healthcare system, in emergency rooms and in hospitals. We have to work on getting kids and families and parents involved, engaged, and active in a healthy lifestyle and preventing primary onset of illnesses and chronic conditions, and we can do it.
Well, it looks like the point that, and I don't like to use the term Obamacare, but for some reason the real
The Affordable
description,
Care Act.
Affordable Care Act, is not active in Louisiana, and I would think that I'm hearing figures as high as over 200,000 persons who could be assisted by the Affordable Act, and yet it doesn't look like it's about to come in our direction.
Well, let me state clearly the benefits of the Affordable Care Act and the implications it has on the state of Louisiana. I think the Affordable Care Act is the single most important thing that has happened in healthcare in the last decade. It has offered access to coverage to millions in one of two ways: expanding Medicaid in the states, as well as creating these healthcare exchanges where folks can go and purchase low-cost health insurance. That is monumental. It is also focused on the right thing. It is focused on prevention.
Yes.
As a result of the Affordable Care Act, all health insurance plans have to include what's called essential benefits, and those include things, screenings, mammograms, colonoscopies, all of the various preventative screenings have to now become a part of every healthcare plan that's offered.
But since that isn't part of what happens in Louisiana, those things are not happening?
Well, those are that part of the legislation is happening in Louisiana because those
Okay.
exchanges are available to every American if you qualify. Now, where Louisiana has a disconnect from the other parts of the world that have participated in various aspects of the Affordable Care Act is in the following. Governor Jindal has decided not to expand Medicaid. Again, there's two components of the Affordable Care Act. There's the expansion of Medicaid, and then there's the creation of the exchanges. You have to fall in a certain income category to qualify for the exchange, where you actually purchase the insurance yourself, or under the Affordable Care Act, if you don't meet the income qualifications, you could, through the expansion of Medicaid, become eligible for Medicaid. In the state of Louisiana, the governor has chosen not to expand Medicaid. What that in fact has done, we have about 633,000 uninsured individuals in the state of Louisiana.
Say that number again.
We have 633,000 uninsured individuals in the state of Louisiana. Under the Affordable Care Act, about 98,000 would not be eligible for Medicaid or anything under the Affordable Care Act because they make too much. They're over 400% of the federal poverty guideline. There's about 350,000 that make between 138 of federal poverty and 400, which is the group that would qualify for exchange, the marketplace exchange coverage, where you can go and purchase it. There is another 214,000 who will remain uninsured because we chose not to expand Medicaid. So what we've in fact done is left out opportunities or left opportunities on the table for us to cover more uninsured.
Yes.
In the state of Louisiana. So there are a large group of people, and the estimates are about 350,000 will be eligible for the exchange, and that includes about 77,000 who would have been eligible for Medicaid in the state of Louisiana. But because we didn't expand, they'll have to go to the marketplace and purchase it. Now, there's a big difference that one has to understand. The marketplace, you pay low cost, but you pay for it. Medicaid is a subsidy. You don't pay out of pocket for the Medicaid coverage. So we've pushed 77,000 people onto the exchanges who otherwise would have been eligible for Medicaid because we didn't expand. And two, we left 214,000 people uninsured when the opportunity became available for us to insure them. It doesn't make sense to me, but this is one indication of where there's a disconnect, in my opinion, in the state of Louisiana on how we can generate so much revenue in some of our economic activity, yet leave half of our country or half of our state in a challenged health status, where we're ranking second amongst all the states in the country, second worst in just about every health indices.
And we'll be back in just a moment.
Sponsored by, do you want to boost your student scores on the ACT? We can help.
And welcome back to Let's Talk About It with our guest, Lynn Medley Long, CEO of Baton Rouge Primary Care Collaborative. And Lynn, when we left, we were talking about the Affordable Care Act. And with the growing number of persons who qualify for the Affordable Care Act, is Louisiana prepared? How do you get prepared? And it's, of course, a lot involved in absorbing that number of persons, because we're talking about, somewhere around 200,000 people?
Across the country, Bobbie, there's about 62, as I mentioned earlier, million uninsured people.
How many?
62 million. The estimates are uninsured.
62 million
Yes.
people uninsured.
In the country.
In the country.
And community health centers across the country serve about 22 million of those.
Okay.
In the state
right now.
right
Okay.
In the state of Louisiana, we serve about 200,000 of those. There's about 600,000 uninsured in Louisiana. The community health centers in Louisiana serve about 200,000 of those. When Obamacare is fully implemented, community health care centers will be servicing or providing services to 35 million. So that's a 15 million increase. 15 million people, more people in community health centers alone. That number could be greater across the health care spectrum. The point is, Obamacare creating insurance access for people with from 138% of poverty, their income, up to 400% of federal poverty. That's going to be a lot of people, millions. One of the big implications of Obamacare in Louisiana and in the country is there's going to be millions now accessing health care that hadn't in the past, because health care is harder to access when you don't have insurance. Okay. Millions will gain insurance under the new medical health insurance exchanges who qualify. Millions. So the healthcare systems, including federally qualified health centers like Baton Rouge Primary Care Collaborative, have to be prepared. Or the big question will be, are we prepared for this huge influx of millions of people now seeking healthcare?
And we'll be back in just a moment.
Sponsored by, do you want to boost your student scores on the ACT? We can help.
And welcome back to Let's Talk About It. Lynn and I were talking about the Affordable Care Act. And Lynn, we talked about the positives of it. Are there any downsides to the Affordable Care Act?
Yes, there is. Not necessarily downsides, potential downsides. We had talked about the fact that millions are now going to have access to health insurance coverage either through the exchanges, not in Louisiana through expansion of Medicaid, but in other states they'd have access to health insurance either through expansion of Medicaid or the exchanges. The potential downsides for places like Baton Rouge Primary Care Collaborative and other community health centers across the country is that we've typically relied on direct federal support to help offset the cost associated with providing care for the medically needy. And again, we talked in the past about the comprehensive services we provide, how we treat the whole person. Under the Affordable Care Act, as many people gain insurance, the kind of care we provide at community health centers have typically gone unreimbursed by the health insurance community. the behavioral health services that we provide, the social work services that we provide, that are all a part of what we consider whole person health care, wraparound services that are all a part of a routine medical visit in a community health center. These things have typically not been reimbursed and currently are not reimbursed in the traditional structure of reimbursement when someone is insured. Your commercial plans don't cover this. So
they're covered at your
this is where the direct federal funding comes in to help us offset where we don't get paid for these wraparound services. Community health centers and federally qualified health centers receive some additional direct federal funding to help cover the costs of what is not paid for traditionally.
Okay.
And with the advent of the Affordable Care Act, one of the potential threats is there are some who think in our Congress and around the country that if everyone's now walking around with a health insurance card, there may not be a need for direct support to community health care centers. Just let everyone purchase health insurance and everyone be paid through the health insurance system. Well, again, community health centers are very, very unique. There's no one. We are the gateway to access to preventative services. We provide comprehensive wraparound whole person health services. No insurance company reimburses for all that we do. So if there is a potential threat for someone in the Congress to not fund community health centers at the current level and continue to increase funding as we expect millions more to start seeking health care now that they get insurance under Obamacare, then that could create, both of those situations could create a serious threat to our ongoing sustainability.
Now I have a question.
Yes, ma'am.
So right now, let's say as you are getting more of the patients in who are using the Affordable Care Act, you get paid for that. So it's the
partially paid.
Partially
paid.
Okay, so there would not be enough to offset
our costs, correct.
The cost.
And that's where the direct federal funding is important for us. So one of the potential threats to us under Obamacare is that they would cut this direct federal funding off, thinking that we should be able to get reimbursed and paid to cover our costs, as most providers do.
So it sounds as if you need to make this known early enough.
Well, we just came out, we do an annual what we call Policies and Issues Forum nationally, once a year through our National Association, the National Association of Community Health Centers. We just left Washington a couple weeks ago, petitioning Congress, our legislature at the federal level, to ensure that they were educated and aware of this potential threat to community health centers under the Affordable Care Act.
Good.
That they need to make sure that they continue to sustain our direct funding and also increase it, as again we serve as the pipeline to access and preventative services in this country, and we are expecting a huge influx with more insured people in this country. So they need to sustain our funding and increase our funding and not cut it under the Affordable Care Act.
Well, that's the thing that, has to be in place, that everyone's aware. I think what happens so often is that the information isn't made available early enough.
Let me add one other.
Our time is up. So we're not going to have time, but maybe we can have you back again.
I'd love to.
Okay. And to my viewing audience, thank you so much. And I hope that the conversation today has been of value to you. And we'll see you the next time on Let's Talk About It.